It may have pinched a bit, but 102-year-old Norma Tribble became one of the first care home residents in the country to get her COVID booster today. It was a big moment for the vaccination teams who have been waiting for weeks for the government green light, and of course for those getting it.
Very pleased to have it, because I know you can't eradicate every infection, but at least it gives you something to build against against something. If you do develop it, you have a chance of overcoming it and not being too much of a burden on the NHS.
It's done a lot of good, I think. It's done a lot of good to help me and help everybody else really in the world. Yes, to have these vaccines, yes. I don't mind, you see.
Booster jabs are being rolled out because of concerns over waning immunity for those who had their second jab several months ago. The over 50s, younger people with health conditions and frontline health and care staff will be offered it in the coming weeks and months, and also, where possible, the flu jab at the same time.
This winter, we don't want people to have COVID and flu at the same time. It will be a tsunami and a disaster for both the patients and the NHS. So if people can have both of the vaccines, it just gives them so much more protection.
And is the evidence there to say that it's safe to have them both together?
Absolutely, yes. There's been a lot of trials, and JVCI are happy and confident that it's safe to give both at the same time.
And with a huge demand on the NHS at the moment expected to increase through winter, it's hoped that these booster jabs should go some way to help alleviate the pressure.
It's about looking at the bigger picture, looking at the things that hopefully we can improve, that we can start tackling, and those that maybe we can't. And I think overall, being able to come in and do the booster vaccinations is a really positive thing. And if it goes anywhere to reducing some of that pressure, then, we've got to crack on.
And on a practical level for the residents, the booster jabs are about keeping the freedoms that the original jabs gave them.
It'll be really nice for them to spend more time with their families, able to go out and be out in the community. Because as we know, a lot of people aren't wearing masks now, so they'll be a lot safer in 2 weeks' time.
All staff at the care home were also given boosters today. It isn't yet known how long they'll be effective for, but it's hoped that it's long enough to see the country through what's predicted to be a difficult winter. Steve Knibbs, BBC Points West, Cheltenham.